For many, the HIV/AIDS crisis brings about memories of a time when a diagnosis meant being shunned, severe illness, and inevitably death. Today, while a cure has still yet to be found, a pill called Truvada provides 92 to 99% protection against HIV for those who take it daily but are not yet infected. Confidential and affordable Truvada prescriptions, also known as PrEP, is readily accessible to adults in need. But how accessible are these treatments for minors? According to the CDC, in 2013, only 48% of people in New York with HIV aged 13 to 24 took medications that reduced their virus to very low levels. A new proposal from Governor Andrew Cuomo, however, aims to change that. As part of his administration's goal to end new HIV infections in New York by the year 2020, Governor Cuomo wants the legislature to pass a law giving minors a right to confidential access to HIV prevention and care. Joining me now to discuss the governor's proposal, current state of AIDS in New York, and advancements in prevention, such as pre-exposure prophylaxis, or PrEP, is Executive Director of the Ryan Chelsea Clinton Community Health Center, William Murphy. Well, nice to have you here with us. Let me ask you to start off by explaining the governor's proposal here and what it contains.
Well, it is pretty straightforward in that already in New York State, adolescents, or I should say minors, defined as somebody 17 or younger, have the right to consent to HIV testing. That already exists. It has for many years. But if they want to have treatment, either the preventive treatment, which is PrEP, or treatment for HIV, they're not allowed to consent on their own, except under certain circumstances. So what the governor and the New York State Department of Health AIDS Institute have put forward, and this is with expert consultation and in light of the fact that we have a biomedical intervention that can effectively prevent HIV infection, what they put forward is the idea that if somebody is at risk and is able to get tested for HIV and is negative, there should be an ability for them and their physician to assess their risk and make a decision to begin preventative treatment, which is PrEP. That risk assessment is done with the physician because PrEP is a prescription. So, you know, where there isn't a responsible adult present in a minor's life, or if a minor has to have the ability to consent on their own because they aren't able to reveal certain things about themselves to their parents, the physician involved with them can help them to make that decision.
So this is all being done in conjunction with advice from a physician. What do you say, what is the answer then to people who might look at this program and say, I've got a concern about it? And they might be people who are not the least bit biased or prejudiced about anybody's lifestyle, but they might just say, doesn't this PrEP process, and even what the governor is proposing here, doesn't that have a side effect of encouraging conduct that we might not want to encourage?
Sure.
What's the answer to that?
Well, I think the answer is that we have to have that dialogue. You know, in the gay community in New York and around the country, when PrEP first became available, there was a similar dialogue. You know, we've been practicing safer sex. We've been educating people about safer sex since nearly the beginning of the epidemic. Are we just throwing that out the window now? Or are we encouraging people whose behavior is putting them at risk to have more of that behavior? Are we going to absolve people from having to use condoms? Those things all need to be discussed, and there needs to be a transparent discussion about that. And there has been, and there's an evolution in thought and acceptance that happens during that discussion. The point really is that this is an additional layer of prevention. Once we go through that discussion of, well, you know, there's a moral aspect to this and it conflicts with my beliefs, we can get some of the information out about who's actually at risk and who this is really intended for, and who is eligible for this kind of an intervention. Then we can move to the support for those people, finding them, getting the information to them, and then bringing them into the conversation about, well, how do I take it? How are people going to feel about me? How am I going to feel about myself?
Last quick question for you. Is there reason for us to be optimistic when the governor says the goal is by 2020 to eliminate new HIV infection cases? Is there reason for us to be optimistic that we can do that?
Absolutely. The Ryan Center has been involved with the HIV epidemic from the very beginning. Our patients were in the 80s. We served the communities in Manhattan that were at the epicenter of the epidemic. So from the very beginning, our boards of directors decided that this is something we have to pay attention to. These are the people that are our patients, and we're going to set policies and we're going to set direction to allow that to happen. So there's a lot of reason for optimism. We've been waiting for years for this kind of an effective preventative treatment, and now it's here, and we're getting the word out about it.
Good to hear that there's optimism. William Murphy, thanks for spending some time helping us to understand all of this. You be well.
Thank you.